The International Council of Nurses yesterday launched a report which reveals that many experienced nurses are planning to leave the profession at the end of the pandemic and that some have already called time. The ICN says the implications for future health systems is potentially catastrophic. The COVID effect, coupled with the current shortage of 6 million nurses, could mean the global nursing workforce of 27 million nurses being depleted by 10 million or even halved, with growing non-COVID healthcare demands waiting in the wings of the pandemic. Via Skype to talk to us more about the report is the International Council of Nurses CEO, Howard Catton. A very good morning to you, Howard. I don't know what time it is where you are, but a year after COVID-19 was declared a pandemic by the World Health Organization, would you say the governments of the world have done enough to equip nurses and medics to help quell the effects of the virus in the health sector?
Good morning to you. Governments everywhere need to do much more. We've been reporting on the impact of coronavirus on nurses around the world since the outbreak. The physical exhaustion nurses are under, the mental toll that it's taking, often the lack of resources as well. In a way, it's unsurprising that we are seeing in our latest report an increase in numbers of nurses who are actually leaving, and also an increase in the intentions of nurses to leave over the coming months. Some through sickness, through anxiety, through burnout, others who feel that they just have no more to give. As you said, this comes on top of a global shortage of at least 6 million, could be even more than that. What's setting up here is a perfect storm between the increasing demand that we have for health services, not just COVID, but all of the other health needs that we have, at the same time as we see a reduction in the supply of nurses and other healthcare workers. This needs urgent attention from governments everywhere.
What exactly does the report entail?
So we highlight the numbers of nurses who could be leaving, but we also highlight that this is much more than just a numbers game. These are very experienced nurses with 20 or 30 years of experience. These are the sorts of nurses who mentor and coach new generations that are coming through. These are the sort of nurses who, in a clinic, in a hospital, in the community, they're the people who make sure that the quality and standard of healthcare is maintained. These are the sort of people who instinctively know if something is going wrong with a patient and how to intervene. Losing that experience, even if we were to train new nurses straight away, that's going to take another 3 or 4 years before those nurses are qualified, but there's still going to be new nurses. That's why we're saying we need to absolutely do everything that we can to retain these experienced nurses. They're going to be the foundation stones of our health systems for the next few years.
So what can we attribute the exodus of nurses to exactly? What does the report say about this?
So I think that first, the intensity of the work. Nurses are used to demanding work, but then just the sheer numbers of people who've been very, very sick. We've been trying to find new treatments. The number of people who have been dying, added onto that, the mental health strains and pressures as well, not just from work, but outside work. Nurses have experienced victimization and abuse in some places for people who are fearful that they're carrying the virus. That pressure of work, that feeling that you are not able to do as much as you can, for some nurses that results in them saying, look, I can't give any more. I can't go on. My fear is as well that those decisions, I'm a nurse, some people who are nurses, if they leave the profession, that's not an easy decision. It's not something that they're likely to change in 6 or 12 months' time. This is why we need to really focus on how we support and retain the nurses that we have. They are, as I say, they're the gold, they're the foundations on which our health systems are built.
Yeah. So how can governments or healthcare leaders ensure that the sector is fully capacitated in times of pandemics and stays as a career destination continuously?
So I think there are a lot of things just in terms of making sure that nursing staff, healthcare workers are safe and protected. They've got the equipment, they've got the supplies, they've got the PPE they need. Make sure that there is support available for people's mental health, that they get a break, they get some time out. There's people that they can talk to if they feel under pressure as well. Be aware that these people, these nurses, health workers are trying to balance life at work and life at home as well. So be flexible in terms of how you support them to do that. Pay is important, not as a recognition just for the huge and tremendous work that people have done through the pandemic, but it's a way to hold people in the system. I think about it like it's a way that you can ensure the security and the safety of your people and populations by making sure that you keep hold of your nurses and your health care staff as well. Those are some of the things that people feel valued, respected, listened to within their health system.
So nursing used to be an aspirational vocation for years. Can we say that it's dying as a vocation?
Definitely not. This is a really tough and intense time. But what we are seeing in some places around the world, that the pandemic has shown the reality of modern day nursing. It's shown that the immense difference that you can make if you're looking for a career to make a difference to people. Look no further than nursing. And we are seeing an increased interest in the numbers of people who want to come into nursing. This is happening at the same time that other parts of our economies, people are losing their jobs in transport, in retail, in hospitality, for example. I think there is an opportunity here to both address the issues of shortages, the pressures that people are under in our health systems, but also provide people who are losing jobs in other sectors the opportunity to retrain as well. So look, this is not this is not all doom and gloom. There are some positives here as well. But again, we need government to step up to be able to see how we can bring these two issues together and find a solution which I think ultimately will be good for health systems everywhere.
Let's thank you for talking to us this morning.
Thank you.
Howard Catton there with the ICN.